So we now move on to the spotter ECGs, the most interesting part of this discussion. So here, a 35-year-old man presents with palpitations. He has been drinking heavily with his friends over the weekend. This is his ECG. So what would you say based on this ECG? Yes. So what do you see here? The heart rate is definitely more than 100. Heart rate is definitely more than 100. 100 per minute. Is it regular? It is not regular. So it is irregular. So what comes to your mind when you say irregular? It could be atrial fibrillation. So now look at the P waves. Do you actually find P waves? Do you find any P waves? No, P waves are not seen. You can see here the P waves are not seen. Yes. So it is atrial fibrillation. Atrial fibrillation. So given this history of binge drinking, what would you say? You need to remember something called the holiday heart syndrome. Holiday heart syndrome. When does this happen? A person binging on alcohol and he develops atrial fibrillation. So that is called holiday heart syndrome. So this is a ACG, characteristic ECG of atrial fibrillation. It is irregular, and the heart rate is more than 100 per minute. Okay. Yes. So this is atrial fibrillation. This is holiday heart syndrome. The patient is having a binge drinking and he develops atrial fibrillation. Okay. So these are all spotters. I want to discuss it faster. Okay. A 75-year-old man with a history of COPD presents with fever and increased sputum production. So there's some issue with the lungs and he's having an ECG abnormality. So how do you approach this ECG? So in this, what do you think about the heart rate? It is definitely more than 100, right? Heart rate is more than 100, which means tachycardia is there. So heart rate is definitely more than 100. Is it regular or irregular? So you can see it is irregular. So coming on to the P wave morphologies. Is the P wave same in all? You need to remember, in atrial fibrillation, we saw that there were no P waves. Here we will see that there are different morphologies of P waves. You see here, there is a different morphology of P waves. Here the P wave is inverted, here it's upright, it is big. Yes, here again it is inverted. So here you can see like this, you can see a smaller P wave. Here you can see it is joining with this. So the morphologies of P waves are different. So what do you call this? Polymorphic atrial tachycardia. What is it? It is polymorphic atrial tachycardia, right? So this is not atrial fibrillation. Because of the different morphologies in the P wave, it is polymorphic atrial tachycardia, right?